So, got it. Okay. So thanks again for joining us. I'm going to start with a land acknowledgement. So 350 Humboldt would like to acknowledge that where we live and hold our meetings in Humboldt County is on unceded territory and ancestral homeland of an indigenous nations, which include Tolowa, Hupa, Karuk, Matol, Wailaki, Wiyot, and Yurok. We thank indigenous nations who have been caretakers of the land. And additionally, we realize that the well-being of all people is bound up with that of indigenous peoples, and we must all take action on the climate. And so this acknowledgement compels us to take action by supporting the Anishinaabe people to resist Line 3 by writing to the Army Corps of Engineers, and that is Jamie Pinkham, I believe that's how you say it, to call for a full federal environmental impact statement to assess Line 3's threats to treaty rights, water protection, and the climate. And for those of you who don't know, last Friday, Line 3 became operational. And this is going to result in 193 million tons of carbon dioxide emitted each year, which is massive, and this line needs to stop. So I'm going to drop the action link in the chat for those to do that now or directly following this meeting as our action. So a bit about our speaker tonight. Wendy Ring is going to look at climate action through the lens of health. And so in this Zoom presentation, she will talk about local climate health impacts, the benefit of climate actions, and how to communicate them to the public. We're also here just a brief perspective on the threat of coal trains that is rolling down the Eel River Canyon. And just a few logistical things before we start. We are going to kind of conduct it as like a webinar, so you all will be muted during the presentation as folks join in. But please put your questions in the chat, and during the presentation that Wendy will be giving, and I will present them to Wendy during the Q&A section. So I'll try to get to everyone's questions that you write in the chat. And we should probably start that around 7:45 or earlier, the Q&A. And then, so additionally, we just want to thank our co-sponsors. And again, that's the Coalition for Responsible Transportation Priorities, Humboldt Friends, Cooperation Humboldt, and the Climate Action Campaign of the Huff and 11th Hour. And I also just want to give a thank you to Pat and Dan as well for helping organize the talk, and Wendy. So Wendy Ring is a longtime Humboldt resident, and she received her MD and master's degree in public health from Columbia University. She is the founder and medical director of Humboldt's first mobile clinic, and she cared for Humboldt's homeless, undocumented, and uninsured for over 20 years. And she is now retired, but she is a full-time advocate for climate action. And back in 2012, her first act was to ride a bicycle across the country on a speaking tour about health impacts of climate change. And so Wendy works on climate with state and national health professional groups, as well as in our local community. And she also produces a radio show podcast called Cool Solutions, if you haven't heard of it, about climate action from the bottom up, which airs on radio stations across the US. So now I will excited to hand it over to Wendy. So thank you for being here, Wendy.
Okay. So I am going to share my screen.
Back up a little too, please.
And let's see, where do I need to go now? Sorry, guys. Okay. Are we good? You guys
You're
see
good.
screen?
Yeah,
okay.
you're good, Wendy.
Okay, great. All right. Well, 10 years ago, when I first realized that climate change was the greatest threat facing humanity, I wanted to help. I wanted to do something, but I didn't think I had very much to offer. But after thinking about it a while, I realized I had one useful skill from my years in medicine, the ability to translate science into plain English. So my husband and I got on our tandem and crossed the country on a project we called Climate 911. And I was speaking at churches, medical and nursing schools, to community groups about how climate change is bad for our health. So that's how I ended up standing really nervously in front of a Rotary Club in a small conservative town in Eastern Washington, about to give my very first talk to people that I didn't know. I already knew this was going to be a tough crowd. We pulled into town early, and they were having some kind of a festival in the town square with craft booths. And when I came upon this sign, I thought, oh, what have I got myself into? But I went to meet the Rotarians, and as we were waiting for the meeting to begin, I asked some of them what they thought about climate change. And one guy said, none of us believe in it. So I thought, where do I start? What do I have in common with these gentlemen? Aha, the doctor-patient relationship. So I started out by explaining that I was a rural family doctor, probably not too different from their own. And I asked them, if you had something bad wrong with you, would you want your doctor to tell you straight out or tell you what you want to hear? And they wanted it straight. So I told them about wildfires and heat waves and how valley fever had moved all the way north from the San Joaquin Valley up into Eastern Washington. And as I was talking, I was watching, and I saw people nodding their heads, like not the kind, like you're falling asleep after lunch, but they were recognizing the truth of what they were hearing. And after the talk, one of those I don't believe in climate change guys came up to me and said he was thinking about buying an electric car. So this is powerful stuff, and that's really why I want to share it with you. So just to give you a little outline of what we're going to talk about, I'm going to give you an incredibly brief summary of latest research on the health impacts of wildfire smoke, but almost all this talk is going to be about the benefits of climate action, what they are, why they're important to talk about, and some of the best ways to do it. So since I took that bike trip back in 2012, the average number of smoky days in Humboldt has increased from 17 to 45. And California is like a living laboratory for researchers who are trying to find out what this really means for our health. And here's some of the things that they found. Wildfire smoke increases cardiac arrests, premature births, low birth weight, and COVID cases and deaths. And like fine particulates from burning fossil fuel, wildfire particulates increase hospitalizations, but at the same concentration, they increase hospital admissions tenfold. Even though the smoke doesn't last, its effects may be lifelong and even extend into future generations. The researchers at the UC Davis Primate Center have been following a group of rhesus monkeys who were exposed to wildfire smoke in 2008 when they were only a few months old. And they found changes in their DNA, in the part that codes for proteins important in immune response. This is how it works. A methyl group, which is just a carbon and 3 hydrogens, the smallest hydrocarbon that there is, binds to their DNA and it just turns off the gene so that protein's not made. And that genetic abnormality not only persisted into adulthood, but was passed on to the next generation. A subsequent study found the same DNA changes in children exposed to wildfire smoke in Fresno. Another reproductive effect was discovered by a fertility clinic in Portland when they noted that the semen of the same human donors pre and post wildfire showed a 34% drop in viable sperm. So that is the end of the climate change is killing us portion of this presentation. It took me 2 cross-country trips to come to the realization, which has now been backed up by a growing body of research, I'll show you some of it, that you can't scare people into taking climate action. If you just talk about the problem, people feel hopeless and powerless, and that's the opposite of what we need. So talking about climate health solutions and their health benefits has a really different effect. It inspires hope and motivates action. We're fixing something that's broken, and our community gets something in return. Some of the diseases that we'll reduce are even reversible. So contrast that with the message of we must sacrifice now so the future will be really bad instead of terrible. I mean, which of these statements would get you out of your cushion fort? Healthy solutions have another benefit. We're polarized around climate, but good health, clean air, and water are more common ground. So this is from a study that was done by the George Mason Center for Climate Communication. And the researchers at the center divide up Americans into 6 groups depending on their attitude towards climate change. There's the alarmed, the concerned, the cautious, disengaged, doubtful, and dismissive. And they gave subjects from each of these groups an essay with a section on climate health and another section on, a section on climate health threats, and then another section on climate action benefits. And they asked which did they find most useful? And the benefits not only got a better response from the believers, but it also even recruited the non-believers, the doubters and the dismissers. So we can get even more people on board if we just even leave the C word out. In a recent poll by the Pew Research Center, 65% of people said the government should do more about climate change, but more than 70% supported a carbon tax and higher fuel efficiency, and 80% wanted more clean energy and tighter limits on power plant emissions. So with these levels of support, we really don't even need to waste time convincing every last climate denier. The critical tipping point for large-scale social change is supposed to be around 1 in 4 people. So in their heads, we've got close to 3 out of 4 already. We just need to get folks to take action. And what's holding people back is not lack of information, it's lack of something called efficacy. They just don't think their actions will make a difference. Here again, solutions are what's needed. This is one of a number of studies where subjects were given a bunch of images and asked which ones made them feel most able and least able to do anything about climate change. So you can certainly make people feel scared about climate threats, but if you want them to do something, we have to talk about solutions. Thankfully, there's a lot that we can say. That is weird looking, sorry. I don't know what that happened there. I'm gonna go back and see if I can make it. Yeah, okay. The health harms of climate change right now are pretty small potatoes compared to the health harms of fossil fuel. Globally, deaths from climate change are still in the hundreds of thousands, but fossil fuel pollution is responsible for millions. In the US, fossil fuel pollution kills as many people each year as COVID. And it somehow has escaped the notice of the public, not the doctors, but we already had a health crisis before COVID, a giant pandemic of chronic disease that is gobbling up 75 cents of every health dollar. 40% of us are obese, almost half of us have cardiovascular disease, and 1 in 10 of us are diabetic. Most of us either have, are close to someone who has, or have lost someone to one of these chronic diseases. And it's their crazy high prevalence that's made so many people with COVID get so very sick. Now, you may be wondering why I'm talking about heart disease and diabetes when this is supposed to be about climate. We've been conditioned to think that these health problems are caused by our own personal behavior, and that the only way to fix them is for each of us to straighten up or all of us to swallow pills. But trying to change your lifestyle by yourself is like swimming against the current. And when we don't succeed, we feel guilty. I know a lot of us feel the same way about our carbon footprints, but while we're staring at our belly buttons, trying to decide if we should buy recyclable toothbrushes, the real culprits are getting away with literal murder. And they're often the ones promoting this individual responsibility propaganda. The petrochemical industry tells us to recycle. The soda industry tells us to exercise and drink more water. Chevron, BP, and ExxonMobil tell us to carpool. Who invented the carbon footprint calculator anyway? That was BP. So I have tried to help people change their unhealthy behaviors. And I've tried to change my own unhealthy behaviors with only minimal success. But there are things that actually work. Put in a bike trail and more people cycle. Make buses free and more people ride. Bring mobile farmers markets to food deserts and people eat more vegetables. Improve standards for school lunches and obesity in participants goes down. So changing systems, not people, is the key to improving health. And when we come together and transform our energy, transportation, and food systems for the health of the planet, we're going to get a lot healthier too. Here is a list of risk factors for 9 of the top 10 causes of death in the US, which could be decreased by climate action. And I get it that things like heart disease and diabetes may not be as thrilling for you as the climate-driven spread of Lone Star ticks, whose bite makes people allergic to red meat. But as someone who's watched countless people struggle with and die from these diseases, the idea that we could actually prevent them adds extra meaning to my climate work. So let's look at these causes and how climate action could address them. Healthcare only accounts for a measly 10% of health status. Socioeconomic factors have far more influence on who gets sick, how sick they get, and who bears the brunt of climate impacts. Your zip code has more influence on your health than your genetic code. This is a map, oops, back one, of life expectancy in Humboldt by zip code. And between, you can see that there's a difference between neighborhoods in Humboldt of as much as 12 years of life. Low-income neighborhoods and communities of color have more dirty power plants, oil wells, and traffic pollution, higher burdens of things like asthma, diabetes, and heart disease, which make them more vulnerable to climate impacts, less tree canopy, less access to healthy food, less air conditioning, and fewer resources to escape and recover after disasters. We've seen with COVID exactly how this plays out. The health costs resulting from inequity prior to COVID were $93 billion a year, and I'm sure by now we're way over $1 trillion. So this period of climate investment and system transformation that we're in right now is an unprecedented opportunity to address inequity, and that will bring us huge gains in public health. So facing our climate emergency doesn't have to be all grim all the time. This is Evergreen, the Humboldt County climate game. And I want to tell you about it because I'm excited for you to play. And also because it's how I came to really appreciate the huge potential for climate action to improve our health. With the Global Climate Summit in Glasgow approaching, most of you have heard on the news that we're very far from doing what scientists say is necessary, which is to cut our greenhouse gas emissions in half by 2030. I was inspired to create the Evergreen Game after a conversation with friends about people not realizing how far and how fast we need to go, and how even those of us who advocate for climate action often don't know how much each of them would accomplish. So I made this game as a way to give us all the big picture and to start conversations about how we can do our part here in Humboldt. In the game, players work cooperatively to adopt solutions from an assortment of solution cards. The goal is to adopt enough solutions to cover the thermometer, thereby lowering future temperatures. The game had to be winnable, but also to have challenge. So the players start out with some seed money, but not enough to complete their mission. And expensive climate impacts further erode their financial reserves. So the only way that players can succeed is to reap financial savings from their solutions. So I had the idea that this was possible. So I set out to do the nerdy work of calculating all the dollars and cents, and the amount of health savings I uncovered blew me away. So let's start with the second risk factor, physical inactivity, which is responsible for a substantial proportion of cases of obesity, diabetes, heart disease, and some kinds of cancer. Parts of decreasing transportation emissions is getting people out of their cars. We can't blame all of our lack of exercise on internal combustion engines. We've got sedentary jobs, too much screen time, but how we get around is a factor. And our rural habit of driving door to door is why country folk are less active and have higher rates of chronic disease than city people. But no matter why we're less active, active transportation can lower our risk. The infrastructure bill does not contain enough money to do this, but if we did invest enough, that people could safely walk and bike half of short trips, we would save $462 billion a year. So in 10 years, that would be 4.6 trillion, which is more than the 3.5 trillion over 10 years in the reconciliation bill that Congress is wrangling over right now. So these are big savings. Driving less would decrease air pollution some, but exercise is what really drives the big savings. Even if you're active where the air is polluted, unless it's super heavy wildfire smoke, health-wise, you come out ahead. So how would this look here in Humboldt? If we invested enough to install a network of protected bike lanes and safe pedestrian crossings here in Humboldt, we'd save $7.5 million a year on health and lose the dubious distinction of having the highest cycling and pedestrian fatality rate in the state, since protected bike lanes cut collisions and deaths for cyclists and drivers in half. Transit also has health benefits. Walking to and from stops means transit users get 3 times more physical activity than drivers. Fewer vehicles on the road means less pollution and fewer collisions. Non-drivers have more access to services and healthy food, and riders save money they can use for other needs. You might think of this next risk factor as secondhand smoke. We've known for a long time that air pollution is strongly linked to heart attacks, asthma, strokes, cancer, and premature death. Now we're learning that, as we saw with wildfire smoke, it reaches all the way into our DNA, causing things like obesity and diabetes and brain and behavior problems. We're still learning all the bad things it can do to us. One thing health researchers have established in recent years is that these harms occur even at levels of exposure way below state and national standards. And that's why the World Health Organization just last month reduced its standard for fine particulates to about half of the level of what's in Humboldt's air. The EPA is also reconsidering the US standard. Ending fossil fuel extraction is one way to decrease air pollution. Fossil fuel extraction takes a heavy toll on adjacent communities, which are disproportionately communities of color, burdened with other pollution and health disparities. This is especially true in California, where studies in Los Angeles and in the San Joaquin Valley show how oil wells harm our infants and children. These harms will go away if we leave the fossil fuel in the ground. More people in California die from car pollution than from car crashes. In the Bay Area alone, more than 2,500 people die and 5,000 children develop asthma every year from traffic-related pollution. Replacing internal combustion engines with electric vehicles saves $1 in health costs for every 14 miles driven. By stopping the sale of gas-powered cars in 2035, California will save $194 billion in health costs by 2050. And we won't have to wait long to collect, because we know from natural experiments like the Olympics in Atlanta and Beijing and freeway closures in LA that when driving decreases, pollution levels fall within hours, and emergency room visits for breathing problems fall right along with them. When we think about burning fossil fuel, most of us think about cars and power plants, but there's also the natural gas we burn in our buildings for heat, hot water, and cooking. Natural gas pollutes indoors and out. It's estimated that 12 million people in California are exposed to harmful levels of indoor pollution from their gas stoves. And kids who live in homes with gas stoves have a 30% greater risk of developing asthma. The UCLA School of Public Health calculated that if we switch all our gas appliances to electric, the health savings in our North Coast Air Basin would be $24 million a year. While I was looking at electrification, I stumbled upon this low-hanging climate fruit for Humboldt County. These 2 solution cards from the Evergreen Game are both about electric heat pumps. The large card is for replacing wood stoves. And it's so big because old uncertified wood stoves emit a lot of greenhouse gas and also a lot of soot. Replacing them with heat pumps would save over $100 million a year in prevented deaths, asthma attacks, heart attacks, premature births, and missed workdays. The smaller card replaces gas and propane furnaces as they die. This would replace many more appliances, but have much less impact on climate and health. Making new buildings all electric is also really important for the future, but it won't reduce our greenhouse gas emissions very much over the next decade just because we build so little housing. We need to focus on getting our existing buildings ready, though, so that when gas appliances die, especially those gas stoves, there's an outlet ready to plug in an electric replacement. Electrification only helps if the electricity is clean. The Harvard Center for Climate Health and the Global Environment calculated the health benefits of reaching 80% clean energy by 2030. For an investment of $300 billion, we would save over $1 trillion. Humboldt is home to 2 dirty power plants, and these are actually what powers our electric cars and appliances. The biomass plant doesn't burn fossil fuel, but it emits more carbon per megawatt hour than gas or even coal. And because it emits more particulates, closing it would create more health savings. Note that there's really, in real life, no magic funnel that would direct all these health savings to climate action. That's something that we would have to accomplish politically. 1 in 5 deaths in America are attributable to consumption of too much sugar and animal fats and inadequate intake of fruits and vegetables. This isn't always a matter of choice. A low-income family paying 90% of its income for rent, transportation, and utilities doesn't have much left for food. Transforming agriculture from a carbon source to a carbon sink would shift production from animal feed and industrial livestock to more fruits, vegetables, and plant protein. More food would be local and free of pesticides, herbicides, and antibiotics. A Mediterranean diet with half a plate of fruits and vegetables and small amounts of red meat and dairy would cut heart disease, stroke, diabetes, and dementia by 30 to 45%. This is what our plates would look like. And agricultural and nutrition experts say this is not only optimal for our health, but could sustainably feed a future global population of 10 billion people. Contrast that with what our tax dollars are actually paying for, and you can see how farm policy really needs to change. Nationally, the potential health savings of a Mediterranean type diet are $88 billion a year, which is more than the federal government spends on K-12 education. The savings in Humboldt are pretty impressive too. 40% of the food we produce is wasted. And when wasted food goes to landfills, it emits methane, a greenhouse gas 80 times stronger than carbon dioxide. If food waste was a country, it would be the 3rd biggest greenhouse gas emitter in the world. One way to prevent food waste is uniform food labeling. 1 in 4 households throws away good food because of confusing date labels. California passed a law that requires food packages to have only one of 2 designations: used by, which means unsafe after the date, and best by, which means still safe, but the quality may be decreased. We need a national law to do the same. A lot of edible food gets discarded before it ever reaches consumers. And if it was recovered and redistributed, there would be enough to feed every hungry person in the US. 1 in 8 people in our country is food insecure, a condition associated with higher rates of obesity, diabetes, and cardiac risk factors like high blood pressure and cholesterol. Feeding people, not landfills, would reduce hunger and these chronic diseases. Planting trees in cities does sequester some carbon, but more important is their ability to cool. Urban trees protect people from urban heat islands and lower the energy demand for air conditioning by as much as 20%. When the use of air conditioners goes up, peaker plants fire up and air quality goes down. Urban trees also decrease air pollution directly by filtering the air and removing particulates on their leaves. They decrease heart disease, lower blood pressure and blood sugar, and increase physical activity, social cohesion, and mental health. Trees provide about $5 in ecosystem services for every dollar spent on planting and maintenance. You might say right now that green follows the green because there's a really big disparity in tree canopy between rich and poor neighborhoods. And redressing this equity will increase health and climate justice. So I hope I've sold you on the amazing benefits of climate solutions and why we should all talk about them. Now let's talk about how to do it. One of the best ways is to tell stories, and I'll give you a couple of examples. This guy, Sam Moody, is a car salesman who ironically lost 70 pounds by taking public transit instead of driving. His boss offered an employee commuter benefit, so he started to go to work by light rail. He lost 70 pounds from walking to and from the station. And because, as he says, the train doesn't stop at Wendys. Sam kept his car for a while and eventually gave it up entirely. Judy Stalker lives in a low-income neighborhood in Augusta, Georgia. Her high blood pressure was out of control on 5 medications until her doctor enrolled her in a vegetable prescription program that provided $1 a day per household member to buy produce. With access to fruits and vegetables, Judy lost 35 pounds and her blood pressure came down enough that she was able to drop 3 drugs. After graduating from the 6-month program, she stepped up to teach cooking classes for them and now manages a local urban farm. Programs prescribing produce as medicine are operating all around the country. Shaylin Bowen took part in a pilot project last year, which provided 12 e-bikes for essential workers. The project was a big success, with e-bike recipients making 30% of all their trips by bike. Shaylin also lost 70 pounds and credits the bike with improving her mental and physical health during the pandemic. This year, the program is expanding to 100 bikes. These kinds of stories are memorable. They're easy to tell. They bring solutions down to earth and prove that we can do this. And they show that when we change the system and give people a chance to make healthy choices, many people will. Another way to deliver climate health messages is to make what I call a solution sandwich. In a recent study, researchers tried presenting health messages in 360 different combinations and asked participants which was most likely to get them to call their congressperson. As you might guess, the solutions were the most effective, but their effectiveness was enhanced when they were part of a solution sandwich. So a solution sandwich has a climate health harm on the top to add urgency, a solution and its benefits in the middle for motivation, and a call to action on the bottom, because people are empowered if they know there's something they can do. However, just like you construct a regular sandwich, you start from the bottom up. So start with the action you want people to do, then add a solution and benefits, most likely to inspire them to take action, and then lastly, add a climate harm to add urgency to the situation. And you want to be selective. Don't put an encyclopedia in there or your sandwich will be too big for people to swallow or digest. So let's see if we can take our coal train situation and make a solution sandwich. A shady company wants to ship coal by rail to Humboldt for export to Asia. The Powder River Basin has billions of tons of accessible coal that, if burned, would add 47 billion tons of carbon dioxide to the atmosphere. Mile-long trains with as many as 100 open-top cars emit a lot of fine particulates. This is a printout from a trackside monitor showing the dust signature of a passing coal train. Trains carrying other types of freight do not produce these big emission spikes. Powder River coal is also prone to spontaneous combustion. And this picture of smoldering spilled coal was taken a month after a train derailed along the Clark Fork River in Montana. A derailment in the Eel River Canyon would be a disaster. So if I was going to make a coal sandwich, I would say something like, wildfire smoke is contributing to our high rates of COVID infection and deaths. Transporting and burning coal threatens to make our air quality worse. As clean energy replaces dirty energy, we'll see less emergency room visits and hospitalizations due to air pollution. Babies will be born healthier and our elders will live longer. Zoom in to the Board of Supervisors meeting tomorrow, really, please do, and tell them to vote against coal. So I have stuck to the science up to this point. Everything that I've told you has an evidence base, but I would like to take things one step further and just advocate for some joy, because we all need to aspire to more than not being dead or in the hospital. We want more than empty ERs and hospital beds, although that would be nice. We want justice, we want happiness, we want everyone living up to their full potential. So when you talk about climate change and health, think hope, not fear, and build a vision of a better future, and let your love of the people and places that you care about shine through. I still do tours about climate and health, or I did till COVID put a stop to it, but I mostly let these puppets do the talking. These kids are from a summer lunch program in Portland, Oregon, and they're pedaling to generate power for our sound system for a puppet show. I've performed this show about healthy climate solutions with medical colleagues at libraries, county fairs, farmers markets, schools, and parks in 10 states. We go to where people are and we make our health message fun for people of all ages, including ourselves. So one thing that you can do for fun and to learn more about local climate solutions is to round up a few friends to play the Evergreen Game. You can just send me a text or an email or fill out the contact form at our website. We'll bring the game and a facilitator to you. Or you can print out all the materials instructions on your own at cool-solutions.org/evergreen-game. So I would like to leave you with some joy. So I will end, if we have time, with a video collage of clips from the puppet show and then answer questions after the video.
Yeah, definitely. Let's put up the video clip. Let's see here. All right, here it is.
Breathe! Again!
I don't like having asthma. Isn't there a medicine to make it go away?
Medicine for your insides can only do so much when the problem is on the outside. Living here in Smog Town is enough to make anybody sick.
Going to the doctor is bad for your health. I went in feeling great and came out half dead. Doc says I got the sitting disease. Who knew you could get sick from doing nothing? Sitting in the morning sun, I'll be sitting when the evening comes. Sitting right here on the bum till my butt cheeks go numb. The wolves of the West have spoken. They say, get people out of their cars. 1/4 of all car trips are so short, they take less than 15 minutes on foot. The wolves' advice, teach the people to walk. Come on, Diego, load up. Let's go to the store.
I'm a good dog. I don't like to disobey, but it's for his own good.
What's up? You love to ride. Get in. Diego, get in the car right now.
Steady, boy. Eyes on the prize.
Well, it is only a few blocks. I guess we can walk.
Hey, Bob, you're looking good.
Yeah, I lost a lot of weight since I've been walking. My high blood pressure and pre-diabetes went away. No more sitting disease for me.
Fantastic! You know the whole community is getting healthier.
Yeah, Smog Town doesn't fit anymore. We need a new name. How about Greenville?
I like that.
My friends, remember the good old days when you woke in the morning to a foggy haze, inhaling the sweet scent of smoke and exhaust? The future? Forget about it. We'll tear down the wind turbines, rip up the bike paths, and turn this place back to what it was. Cast your vote for Smog Town.
I want what's good for my farm. I vote for Greenville.
I want what's best for our kids. I vote for Greenville.
Now, as members of the audience and honorary citizens of Greenville, you get to cast your vote. So raise your hand if you want to go back to Smog Town. Anybody? Okay, we've got one. And raise your hand if you want Greenville to stay green. Greenville. Okay, Bob, you can't vote twice.
I'm history.
I'm glad we won the voting. I was scared that smoking chimney guy was gonna take our Greenville away.
Son, no one can do that. Greenville is inside us. It's the part of us that cares for our neighbors and wants to make our town a better place. Now that we know how, we can turn smog towns into Greenvilles wherever we live.
So that's how we train the humans.
Nice. That was great, Wendy. Nice. So now we're going to kind of turn to our Q&A portion of the night. And I see at least one question in the chat for now. And so if you have a question, go ahead and type it in the chat and I will present that to Wendy. So let's see here. First, also outstanding talk. Someone mentioned, Karina. And then so Pat said you had a lot of great info on the role of active transportation and helping people stay physically healthy. Is there any info you know of related to how active transportation can also help people stay mental healthy as well?
Yes. Yeah, actually there is. And the numbers that I was using there, I got from a model that was built by the California Department of Public Health. And you could go on there and make different transportation scenarios, and it will show you what the health result is. And it does, I believe it does have depression on there, and it has dementia, I think, too. So you can see the breakdown. There's other information as well, but that's a nice one because you can just go in there and play with it and say, oh, what would happen if we doubled this, or if we, increase this by this much or that. So that's one way of looking at it.
Nice. Okay, and it looks like you got a lot of kudos in the chat. Brilliant as always. You're the best. Thank you. Wonderful. Thank you. I've heard a lot about climate change, but this was specifically helpful with a focus on Humboldt. I agree. There's another question. Is there a game opportunity coming up? I was actually just thinking the same question too as well. Is there, when are you playing the game next, or is there a specific audience for it?
Well, no, it's for everyone. And it's one of those things where right when we were about to start playing, COVID hit. And so we're just delighted if anyone wants to play the game. So, I can put my contact information back up, I guess. It's the easy one is wendy@climate911.org. And anybody who can round up 4 players, we will will bring you the game. We would really like for more people to play, and it can be played socially distanced, and we've been doing a lot of games outside.
Okay. How long is, someone, Susan said it was really fun. I highly recommend it. I guess the question I have is, how long is the game? Like, does it go on for a certain period of time, or is it just?
You mean how long will it be available?
Or just like playing the game? Is it?
How long does it take?
Yeah, how long does it take? Sorry.
It takes about, I'd say maybe 45 minutes. It sort of depends. I mean, because it's sort of designed to create conversation. Mm-hmm. And so the conversation can go on for quite a while afterwards.
Okay. But
the game itself is 30 to 45 minutes. I mean, I've seen people win it really fast, and I've seen people just get in like terrible trouble where they can't agree. And we make them come to consensus, the whole group, before they can play a solution. And sometimes that can be a problem.
I could see that happening. Yeah.
Yeah. Well, that's how you get the conversation, right? And then you see what the consequences are, and they're all sort of Humboldt-based, real things that are, that have been projected that will happen here. So It's pretty fun.
Yeah, I need to play the game. Like, I've been meaning to ask you about it, so I've been keep on hearing it. But anyway, so that's great. Do we have any other questions? Okay. We had another thank you. So thank you, Wendy, from Stevie. Totally agree with you. The need to change systems, but how do we deal with the burnout when so much of our political system is broken?
Play with puppets. I mean, I really do think, I mean, that what I said about joy and fun, I really believe that. I mean, I'm 10 years in now working full time on climate. And if you don't take a joyful and creative approach, I think we do burn out.
Okay, so Wendy, I think you are my hero. Yes, play, do story time. Children are the future, and we need to show them joy. And let's see. Another question from Dan. What are likely to be health impact of climate in 30 years for the people living in hot countries?
Well, there's different scenarios that depend on what happens, what we do. I mean, pretty much what happens between now and 2040 is, I don't know, there could be some difference, but I mean, a lot of it, especially if we can deal with the short-lived climate pollutants, that buys us some time. But the scenarios are depending on how much greenhouse gas emissions we cut and how fast we do it. But I think for people that are living in really hot countries, there is going to be, areas that are just not, you can't grow food, people can't work outside. That stuff is going to happen.
I mean, you're welcome to it.
Right. So, a few people just got unmuted. How did that happen? Okay, we're good. So let's see here. Where did you go, Wendy? Okay, there we are.
I'm right here.
Okay, you're good. Oh, there you are. Okay, perfect. Yeah, that's a really good question too, of thinking that, or even like, I think like even like just excessive like heat strokes, or thinking, see like people living in those like even just like taller, all those buildings, like thinking about that, like how hot it's gonna get with like urban.
Here's something interesting too about heat and health is that how hot it has to be to cause a health impact depends on what your climate you're used to. So for example, there was a big heat wave, I forget when it was, it might have been 2006. And they looked at all the hospital data and they found that the biggest health impact was actually on the North Coast. Because we're used to because we live at lower temperatures. And so an increase that wouldn't phase somebody, who lived in Southern California could be enough to destabilize somebody who has a chronic illness or is elderly.
That's very interesting. Yeah, I even like when you talked about the Humboldt with the 12-year range in life expectancy too, that was very surprising to me.
Yeah, me too.
Yeah, I didn't think about that for Humboldt specifically. It looks like we have something else in the chat. Susan, I sometimes lose heart, but then I remember Atticus telling Scout that courage is giving it to your best, even if you think you're beat before you start. Wendy gives me the strength to keep on, even though I think we're beat. Nice.
Well, here's the thing too about the health benefits. This is why I think it's so important, is because you get them right away. Right. And you get them even if, we can't stop climate change. We are still people, real people in our community that we know will be healthier if we do these things. So, I mean, I don't know if you've ever seen that cartoon where, I don't know if it's supposed to be the UN and somebody says, well, what if we do what if we make the world better for nothing? Have you seen that?
I haven't seen it, no.
Oh, I thought it's old. I thought most people have seen it by now, but yeah, it's kind of, these are things that we can get some immediate gratification out of.
Definitely. I think health is just such a important thing to think about when it comes to the climate. 100%, like it's how we live every day, so well, I don't see any other questions in the chat, but we have a couple minutes, did you want to play part of the game or something else you had in mind, Wendy?
Oh, the game you can't really play online. It's a board game.
Oh, okay. Or you had another activity, I think you mentioned that you wanted
Well,
to do.
yeah, but I just went ahead and sort of did it. It was the
Okay.
sandwich, the salute. Remember we were going to do the
Oh,
solution sandwich?
yeah.
Unless somebody wants to try making one on a different topic, because
Yeah,
anybody want to make a solution sandwich
anybody?
just for practice?
Solution sandwich again. It was the climate. Yeah.
You start with what you want, the action you want people to take, and then you put in the next thing is the health, the solution and the benefit. And then on top of that is the climate impact.
Anybody want to do that? I'm gonna write it in the chat really quick.
So we can make another one for the coal trains if you can't think of another topic.
Oh, yes, I'd like to I like help finding a solution to all the PPE we are using at this time that is, not great for the planet. So much plastic.
Yeah.
Well, not sure if anyone wants to do the solution sandwich tonight.
Doesn't
but
sound
let's
like
see.
it. That's okay.
But I think the solution sandwich is I've never heard it like that. The term, did you?
I just made that up.
Oh, you
So
made it up.
I've never
Okay, I love
before.
it. Yeah. I've heard, that's a great term. So I like that. I think I'm going to use that moving forward too.
Oh, good.
Nice. Well, if there isn't any other questions or comments for Wendy, I just want to say that thanks again, Wendy, for a presentation. Yeah, thank you so much for this presentation. And thank you to our co-sponsors, as well as our 350 members and all of you that attended. If you're new to 350 Humboldt, you can check out our website. 350 Humboldt was at world.350.humboldt, something like that. Yeah, /Humboldt. Anyway, you can look us up. We're also on social media. And but yeah, thanks again, Wendy, for your great presentation. You have more kudos in the chat from a few different people. Yeah, I have a couple reminders too, but thanks so much. Excellent thought, inspiring, informative, and will keep many of us going forward with hope and fun and creativity and joy as you recommended. Also to remind people that McGuire Town Hall is tomorrow, and Bill McKibben is speaking on Thursday too. HSU is hosting or sponsoring that. And just thanks to all of you. And yeah, thank you again, Wendy, and to everyone, and have a great night. Thanks all.